Thank you, everyone. Good morning, afternoon, or evening, depending where you are. This is a paper that we are just starting with Nekia Quashi, who is in the audience, Joseph Science, and Daniela Nunes from Brazil. I want to thank the organizers for doing this. And Eileen, I was amazed to hear that it was 8 years already. So thanks for all of you for doing this special, important workshop. So just to give a background, for this paper, we're going to be looking at the availability or lack of two very important people, usually when we think about social support, especially for older adults, partners and children. As we look at support at older age, for most countries, these two types of family members that provide most of the care, especially in middle income and low income countries. For most part, the evidence shows that if you do not have a partner, right, especially for men, this increases your health risks and your mortality risks. But there are also, we can think about health and mortality risk associated with the fact of being childless. But this depends on the context. So we can think about countries like, one of the papers, for example, of Nekia Quashi and colleagues that showed that even in contexts like Mexico, that having no children might be associated with lower mortality, and other countries that having no children, for example, in Austria, being associated with higher mortality. So context really matters when we're thinking about this association. But there are very few studies that actually look at both partnership and parenthood status together. This is particularly important for Latin America. So the goal of this paper is really to address this gap and look at these two types. Of course, ultimately, we want to expand to other types of family types. But at this paper, we're going to be looking at partnership and childlessness, or having a child. And why is this so important? Brazil is a country that's going to a very fast aging process. And by 2013, we already inverted, and the number of children under the age of 19 became lower than actually the number of people that are 60 and older. This process was very fast due to a very steep decline in fertility. So if you think about in the 1960s, fertility was around 6 children on average per woman. By the early 2000s, was already getting to under the 2, and nowadays it's about 1.6. So it's a very fast decline in a very short period of time. But this process, it's very fast, and the country didn't take the time to really adjust in terms of policies. So there's very limited social welfare for older adults. So families still provide most of the care, and there's very limited support from the government. And this is very important for women because they are the ones that actually provide most of the care. And given that in Brazil, traditionally, men tend to marry younger women, women still take care of their spouses, but the women are left behind when their spouses die, and then really depending on their children for care. When we talk about marriage in this paper, think that cohabitation and informal marriages are very common in Brazil, but we are going to take them as formal marriage. So when we are talking here about partnership, we're talking about formal unions and informal unions. They are very common in Brazil. So for this paper, we're going to be looking at how the lack of these very traditional family ties, particularly having a spouse or having children, will be associated or not with elevated mortality risks. And because early life conditions are so important to both determine health conditions at childhood may affect whether or not later on you might be more likely, if you have a poor child health, to have not being able, for example, to conceive or to have a child, or even to marry, right? On the other hand, poor socioeconomic status might define, for example, to have lower, to have like actually lower age at marriage and have actually more kids usually in Brazil. So it's very important to understand like these early life circumstances and how they may affect actually the formation of the family and also like the childbearing conditions. But it's also important to have this understanding of this the socioeconomic resource, because low socioeconomic status may also affect your trajectory in terms of marriage and number of children, and also the time of some of these transitions. Because education usually is completed before marriage and to have children, not all of the times, but usually we are also going to account for education. For this study, we're going to be using the Brazilian Longitudinal Study of Aging, the ELSI Brazil, is a national representative sample of the Brazilian population aged 50 and plus. The data was collected in 7 cities in all regions in Brazil and has representativeness of the country. The baseline was collected in 2015 and 2016. There was a follow-up in 2019 to 2021, which we are not linking the data. It's not possible at this point, but we are going to be able to use the mortality data that actually was collected all the way through March of 2021. The baseline data is over 9,000 participants, and most of the participants were able to be followed up on the second wave. On this second wave, actually, the participants reported whether or not there was like losses, and so there were losses of the follow-up in terms of like over 2,000 people. But we had in this period over 700 deaths. But out of the 2,000 people that were lost follow-up, their names, age, sex, their location where they were located were linked to the Brazilian Mortality Information System, the SIMS system. And out of these 2,000 people, they were able to find 263 people. There's about 10% of all the deaths. And so these deaths that came not only from the people that were reported by proxy respondents in the second wave that have died, we added, so these 263 deaths because they were linked to the mortality data from the SIM system. It's the same data that James Masinko and Iram and colleagues have used it to actually analyze the quality of this mortality data with the vital statistics in Brazil. And they came to the conclusion that really coincides. The data is very close. There's some misalignment in the early age, in the very old age, but for most part, the data actually fits pretty well the Brazilian official statistics. So in total, there were 970 deaths from baseline to 2021. There were 288 people with missing data on key variables. They had a little bit higher mortality, older people, and they were less educated. We are going to be doing additional analysis later on, sensitivity analysis, to see if this would change our results. But for this paper, we are going to be restricting our sample to 9,204 people with complete data, which yields 926 deaths during the observational period. We're going to be looking at all-case mortality. Our main independent variable will be the partnership variable with the child availability. When we talk here about children, is living children. We did some extra tests and we look at number of children that were ever born. There's some problems because this data we can only look for women, not for men. So here, when we're talking about children, we're talking not ever had children, but actually living children at the time of the survey. And for the partnership, we are looking at formal and informal unions. So in addition to this variable that we have the partner with children as the reference category, we're looking at partners with no children, unpartnered with children, and unpartnered and childless. And we're going to be looking at controlling for age at baseline, the childhood SES, both food insecurity and SES at age 15, and childhood health that was self-reported also at age 15 in education. I'll be providing some descriptive statistics and some Kaplan-Meier curves, and we did gender-stratified Cox proportional hazard models stepwise. So the model 1, we only included the variables related to family status. Model 2, we added the age at baseline. Model 3, we included childhood health and SES. And then the model 4, we added education to the model 3. When we look at the distribution for men and women, both men and women tend to have, most of them are actually have a partner with children. So the prevalence of being partnered with childless or unpartnered with children or unpartnered with no children is very low. For women, having no partner but having a child actually is a little bit higher than for men. So here, so you have a sense, so it's about 9% of the sample doesn't have a child. The proportions are very similar for men and women, as we would expect. But when we look at the difference between men and women for partner, the difference is very staggering and gets bigger actually as the age advances. So the dashed line, that's for men. So the y-axis, we have the proportion of people with partner. We can see that for men, starts at 70% and ends around 60%, but for women, is a very steep decline with age. The results for the Kaplan-Meier show that women have higher survivorship, as we would expect, with the highest one among the women that are partnered and have children. And the lowest, that is the dashed one, the in green, it's for men. They are unpartnered and do not have a child. So for both men and women, having a partner actually increases the survivorship, as we look here descriptively. And when we go to the results are very clear that having a partner really matters in Brazil. Of course, for those, especially when we look at the model 4, having no children deepens, increases the mortality risk compared to only being unpartnered, but having a child for both men and women. But it's really having the partner that seems to make the biggest difference here. If those who have, for example, a partner but do not have a child are not statistically different for those who have to have a partner and have a children. So for Brazil, lacking a partner and a child actually is detrimental for your mortality. But the results really show that it's really being unpartnered that seems to be more relevant in this case. And why this is important? Well, Brazil actually is legalized in the 80s, divorce, and actually the number of people that have been divorced and separated at older age has been increasing in Brazil, which might have consequence for generations actually that have experienced this for longer periods also in their lives. And so one of the analyses that we want to do further is to actually look at the duration of the marriage of the people that are in our sample. But one of the findings is that, for both men and women, actually having no child, it was important, but it's really not having the partner that made the biggest difference. And so for both men and women, the associations were pretty similar, which brings us to maybe the underlying mechanisms might be the same of the lack of these family members for support and for maybe affecting mortality at older ages. So it might be social support, might be partnerships, and the children affecting health behaviors for the life course. We have some limitations. It's not necessarily cross-sectional data, but we only looking at the baseline in this case here. It's only the data from 2015 and 2016 that we have. That is linked to the mortality data. So we don't have several waves that we can look at transitions in marital status or transitions in the number of children or on the family status that we can take a look. We didn't control for midlife circumstances like occupation and all the health status variables We have done some tests, and the results actually remained after we have submitted the paper, the presentation for this conference. So we really want in the next papers, like include other availability of other family members, like parents, siblings, which we also have in the data set, but also look at like more nuanced ways. For example, look at marital dissolution, how long people have been widowed, because this might also like help us have a better understanding about potentially gender differences at the older age. And with that, thank you so much for your attention.